ever experienced any incidents related into this picture? When did it happen? Where did it happen? How did it happen? What do you call to these circumstances? Looking at those pictures, I know that you have realized the importance of strengthening your skills in a physical level. Sports and injury are often go hand in hand, whether you are an occasional, weekend warrior, or everyday athlete. The idea of injury that keeps you away from your favorite sports can be a harrowing thought. Hi ma'am, hi BPED student. I am John Arena C. Cantorna from BPED 1C, and I will be discussing about the sports injury and the effective ways to prevent sports injury. So now, let's talk about sports injury. Sports injury may occur when a person engages into moderate to vigorous physical activity on MVPA. This includes physical that is spanned from moderate to progressing to vigorous intensity. Breastwalking, cycling, and jogging are examples of moderate activities, while aerobic dance and cycling uphills are vigorous activity. On the other hand, sport injuries happen when you are playing sports or performing exercises. These are caused by poor training practices or wearing improper gear. Some people also get injured when they are not in proper condition. No proper warm-up and stretching before you play or exercise can also lead to injuries. The most common sports injuries are sprain, contusion or bruise, concussion, dislocation, fracture, and strain. Let's start with the brief description of this common sports injury. First, sprain is a tear of ligaments, fiber, muscles, or tendons supporting a joint. This can occur when a joint is extended beyond its normal range of movement. A sprain may involve a small number of fibers through a complete ruptured. In extreme circumstances, the ligaments, muscle, and tendons fiber may remain intact and ripped from the bone. The second one is contusion or bruise. It is bleeding into the soft tissue which is caused by a direct blow from another person or an object. A bruise can occur to any soft tissue of the body. We also have concussion. This is caused by direct blow to the head. Depending on the severity of the concussion's injury can cause varying levels of impairments of brain functions. Concussions are categorized into three. First is mild for grade 1, moderate for grade 2, severe for grade 3, depending on the symptoms. Next, we have dislocation. This occurs when a joint ball is forced off its socket. For example, arm forced out of the shoulder joint. Dislocation must be reset by proper medical professionals. The next one is fracture. It's a break or crack or shattering of the bones. We have two types of fracture. We have closed fractures where the broken bones does not pierce the skin, while the open fractures, the broken bones break the skin surface. The sixth one is strain, are injuries that involve the stretching, partial tearing, or complete tearing of a tendon. Strains are categorized as first, second, or third degree. Chronic strains are injuries that gradually build up from overuse or repetitive stress. After enumerating the most common injuries, let's move on and determine the effective ways to prevent sports injury. Number 1. Warm-up is one of the most important and significant ways to reduce the likelihood of injuries when playing sports, and significant warm-up sessions should last at least 5 to 10 minutes. And it involves gently stretching and exercising muscles to prepare them for the strenuous activities to follow. It is vital to start the warm-up slowly and build up gradually to a more brisk and energetic pace. Warming up this way allows an increased flow of blood to reach your muscles. This increases the flexibility of the muscle's fiber and significantly reduces the risk of pulling or strengthening a muscles. You can include warm-up exercise like steady walking or jogging. These activities allows you to gradually increase the pace to further prepare your body for more strenuous activity. Number 2, use the correct protective equipment. For some sports, protective equipment is important, especially when the sports or activity involves physical contacts in other players and participants. Protective equipment may include shin pads, boxing gloves, and protective headgear. All the equipment is designed to prevent injury to vulnerable parts of your body. It also important to wear correct footwear when participating in sports. The correct shoes can offer support to your foot or ankle, helping prevent any twisting and injury. Protective headgear is obviously extremely important as helmets protect your skulls and brain from damage. This is vital in contact sports where you may knock your heads with other players. Number 3, drink plenty of fluids or water. Whatever sport you play is essential to maintain your fluid level to avoid dehydration. If you become dehydrated, you'll not be able to regulate your body temperature as effectively, which means that you'll risk overheat or hypothermia. Will also adversely affect your performance as your blood volume will be reduces and you'll be less able to deliver oxygen to your working muscle. It's best to start any activity while dehydrated. You can assess this by checking if your urine is clear and not concentrated. Drink before and during your sporting activities. Continuing to drink after you have finished will ensure that weight loss through fluid depletion is replaced. Number 4, wear appropriate clothing. There is no benefit to exercising when you're dehydrated or hypothermia, so always wear appropriate clothing which should be light and permit your sweat to evaporate freely. Sweat only cools you when it's evaporate off your body. Conversely, don't deliberate wear excessive clothing that may cause you to overheat. If you do, will lose even more body fluid unnecessary, which can have an adverse effect. Sweating excessively does not help you lose more fats. In hot conditions, the weight difference before and after a bit of exercises is many body fluids, all of which must be replaced for you to maintain a healthy state.